Pharmacy 109, Body Systems, Diseases, and Drugs. Here we are, Chapter 18, the last chapter of the semester. Congratulations. Okay, so this chapter is about basic diagnostic tests and what can we determine from these tests. So, diagnostic tests help to provide a more accurate view of the patient's overall condition. So, we can use it to help determine the diagnosis, what the progression of the illness is, or if there's been improvement in the illness. And we also are going to talk about diagnostic testing, um, kind of like how you keep up your car, but we're looking for certain things in the body as well. We're looking for signs and symptoms, and then once we run the test, we confirm those signs and symptoms to be what we thought they were, or perhaps we determine that it's being caused by something else. So, for this chapter, we're going to list and describe the diagnostic tests that we use in clinical settings, determine which test or test should be given or chosen to determine the patient's suspected disease state, recognize abnormal findings for several of the most common diagnostic testing, and determine conditions that may produce these abnormal test results. So, to understand what diagnostic testing is, the purpose is to help determine specific cause for different signs or symptoms that a patient may be experiencing. Also, to confirm the effectiveness of a prescribed treatment. And that's where we would see a change in the lab values, perhaps. This is meant to be used in combination with a good, strong patient history as well as physical examination. Important things to keep in mind when interpreting the lab results. Now, as a pharmacy technician, we don't actually interpret those lab results. That would be a pharmacist's responsibility. But again, being a better trained and educated technician, having more information, an extra set of eyes can help catch things. Also know, hey, this doesn't look right, or bring it to the pharmacist's attention. So we're going to learn it in context. This is not something that we will necessarily apply every day. So first, let's talk about some blood testing and some different pieces and parts of the blood itself. So basics of blood, it's a vital fluid. Without blood, we cannot survive. Blood communicates with all parts of the body. It also helps carry messengers like hormones. It is composed of primarily a liquid portion known as plasma, and plasma is made up about 90% of water. There's also a cellular component. Now, these blood cells are produced in the bone marrow and include the red blood cells, which are known as erythrocytes, white blood cells known as leukocytes, and platelets known as thrombocytes. So we've already learned that in a previous chapter, but that's just a little review. So red blood cells help maintain our oxygen levels. They transport oxygen from the lung to the body's cells by way of hemoglobin. White blood cells help to protect against infection. There's actually 5 different types of white blood cells. Then platelets or thrombocytes help the blood clot so that we don't bleed to death from any kind of cut, abrasion, or internal bleeding due to bruising. So let's look at the white blood cells. So here we have the different kinds of blood cells in general, sorry. So we have our erythrocytes. So we see that those are kind of disc-shaped with a kind of indentation. They help transport oxygen and carbon dioxide. Then we have our platelets over here. So they like to clump together. They kind of have a sticky property to them. We call that aggregation when they come and clump together. That's good when we're trying to not bleed, to have that platelet aggregation. But in clinical cases, sometimes we have too much of that platelet aggregation, and that could actually cause a blood clot. Now, the white blood cells, the leukocytes, like I said, there were five of those. So we have morphonuclear granulocytes, and we have mononuclear cells. So mononuclears have one nucleus, and polymorph could have multiple morphing or changing nuclear centers. So the mononuclear cells include monocytes and lymphocytes, and these are often used the body's response to infection. They are the kind of first responders, if you were. They're the front line of the army. They go out to see what's going on, especially these monocytes. They tend to be macrophagic, going out to try to figure out what's causing an infection. Lymphocytes are part of the white blood cells that are used with the lymphatic system. Then we have our more specific white blood cells. We have neutrophils, eosinophils, and basophils. And the eosinophils are, for example, are ones that respond in an allergic response. So blood testing. We do blood testing for a variety of different reasons, and we can extract a variety of different outcomes or information from these blood testings. So to obtain blood samples, most of them are done through a venous draw. Uh, the blood that comes from a vein is going to be very dark in color, kind of a dark burgundy-ish kind of color. The veins have a bluish tint to them through the skin. If you look at your arm, your forearm, um, generally you can see some of those veins up on the surface. Some samples can be taken as a pinprick to the finger, such as we would use in a finger stick blood glucose um, level. We would use a lancet, just a little kind of a pinprick kind of thing that would bring that blood to the surface. And then sometimes we do ABGs, or arterial blood gases, to find out what the oxygen level is in the blood. Now, your arterial blood throughout most of your body is the blood that's just come from your lungs, so that it's rich in oxygen. When an arterial blood gas is drawn, that blood is very, very bright red, kind of like the blood that when you cut yourself, because it comes to the surface and mixes with the oxygen in the air, it's bright red. So we use that to see what is the perfusion of the oxygen, the concentration of the oxygen in our arteries. So here's a picture of a finger stick used with a glucometer to determine how much blood glucose or sugar there is in your bloodstream. And diabetics would do this perhaps even several times a day to maintain or verify their glucose levels. So some of the things that can be determined from blood testing, red blood cell disorders. One of the more common red blood cell disorders is anemia. There's lots of different kinds of anemia. There's normocytic anemia, where all the blood cells are normal, there just aren't enough of them. And then we have some other types of anemia that are caused by malfunctioning red blood cells. So generally speaking, there's not enough red blood cells that are working properly to carry the oxygen we need in our blood. And some of the reasons that we could be deficient of red blood cells and have anemia could be that we have blood loss. It could be due to dietary insufficiency. Iron is needed for the hemoglobin. The hemoglobin in the red blood cell is the part that carries the oxygen. So if the hemoglobin isn't functioning properly, the red blood cell can't carry the oxygen. Other types of anemia include pernicious anemia, which is a deficiency in vitamin B12, or what's known as cyanocobalamin. And then we have folic acid deficient anemia. And with that, we have immature red blood cells. They don't function properly. So in both of those cases, the blood isn't able to carry the oxygen. Now, in treating anemia due to a dietary insufficiency, it has to be identified what is that dietary insufficiency, and then that needs to be corrected. So if it's iron deficient anemia, we would use iron supplements. If it's pernicious anemia, we would use cyanocobalamin. If it's folic acid deficient anemia, we would use vitamin B9 or folic acid to replace that. It could also be due to a decrease in red blood cell production, which could be caused by disease or medications, a condition that we call bone marrow suppression. It could be autoimmune, or we could have an increase in the red blood cell destruction. So our body makes and replaces red blood cells about once every 3 months or so. So if there's a disruption in we get more broken down than we're supposed to, or there isn't enough being made to replace what's getting broken down, we could suffer from anemia. Now, on the other side of the spectrum, we have polycythemia, which is elevated levels of erythrocytes. Um, Causes for that could include chronically insufficient amounts of oxygen in the blood, so your body wants to start making more red blood cells, thinking if I have more, then I can carry more oxygen. Dehydration can cause overproduction of red blood cell, diarrhea, severe diarrhea, which also can result in dehydration. High altitude sickness can create more red blood cells, and then an overproduction by the bone marrow. On the white blood cell side, we have higher than normal white blood cells, known as leukocytosis, or a deficiency in white blood cells known as leukopenia. So penia means deficient. So erythrocytopenia, low red blood cells. Leukopenia, low white cells. In leukocytosis, or elevated numbers of white blood cells, there is when they do a blood test to determine the white blood cell count, we find that it's greater than 10,000 cells per millimeter cubed, and that generally can be caused by an infection. Your white blood cells go into overproduction to try to kill off any kind of foreign invader during an infection, so that would increase your white count. Um, Coma, hemorrhage, leukemia can elevate your white blood cells. Cancers, malignancies, menstrual cycles, steroid therapy can increase all of your blood cell productions, and stress or pain or excitement can increase your production of white blood cells. Now, causes for deficiency have many causes. What is considered deficiency is when those white blood cells counts fall below 4,000 cells per millimeter cubed. Overuse of alcohol, viral infections, your lymphocytes would increase, but your other white blood cells can decrease with a viral infection. Medications, due to again causing bone marrow suppression, a fever, severe electric shock, tissue necrosis, toxins in the body, and then trauma or tissue injury. So all of those could result in a deficiency of white blood cells. So platelets being your third blood cell, we have thrombocytopenia, which is a deficiency of thrombocytes or platelets. The number is below normal, and that could lead to a decreased ability to clot. That can be caused by viral infections, vitamin deficiency, specifically vitamin K, which is also known by the name phytonadione, medications, especially cancer medications that cause bone marrow suppression, cancer, heart disease, even tuberculosis, high altitude living, and iron deficiency can all result in thrombocytopenia. Now, elevated platelet counts could cause the blood to overclot, causing more platelet aggregation. And that can result from a splenectomy. So if someone's had an injury to their spleen and it had to be removed, it could result in elevated platelet count. Trauma, vitamin K deficiency, vomiting, and excessive sweating or with a fever. Now, talking about specific types of blood tests, we can perform specific ones to identify a component. It's usually performed on venous blood that has been centrifuged. So they put it in a machine, spin it around, and all of the parts will fall out with the heaviest falling to the bottom of the tube. So the upper level is going to be much lighter in weight and color, more plasma or liquid part of the blood. So in your book, there's this photo. So the blood is drawn from the vein and put into a test tube and put into the centrifuge where it's spun around, and it separates out the components. So here we have the cellular components that fall to the bottom and the liquid component at the top. So it talks about the different pieces that can fall out and what can be measured, found in that liquid portion that's dissolved down, and then in our formed elements, about 45% of the blood would make up this sediment component that falls to the bottom of the test tube.